I will talk about the most common symptom in society: shortness of breath, breath hunger. Why is our breath narrowing? There is a severe shortage of breath in society. People visit many departments with complaints of breathlessness. This is exactly the subject of our video. Why do we feel short of breath? Here are the top 10 reasons. Perhaps the most crucial factor contributing to shortness of breath is heart failure. In heart failure, the heart's pumping function is impaired and it cannot pump a large portion of the incoming blood. When there is insufficient heart function, edema can accumulate in the legs and also in the lungs. One of the most important reasons for shortness of breath caused by accumulation of edema in the lungs due to heart failure. If your breath has started to narrow recently by climbing uphill, making effort, climbing stairs, then heart failure should definitely come to mind for that time. Heart failure is a key cause of breathlessness. The reason for breathlessness in heart failure is the reduced pumping function of the heart and the fluid accumulation in the lungs. You can diagnose if you have heart failure or not with echocardiography. It's enough for you to have a heart-related examination in this case. If there is heart failure, we want to start treatment quickly and reduce the risks. The second reason is rhythm disorder. For instance, in conditions like atrial fibrillation or frequent premature beats, the rhythm can accelerate with exertion. When the rhythm is disrupted, with a serious acceleration in the relationship, the person can't tolerate it. When the pulse is typically 70-80 at rest, it can rise to 140-150 with exertion in the presence of a rhythm disorder and inadequate heart function. Shortness of breath can occur similarly to the symptoms of heart failure. Keep in mind that rhythm disorder is one of the most common causes of shortness of breath. Since this is also related to us, I recommend you have a cardiology exam. The third common cause is heart and vascular blockage. You may not have heart failure, you may not have a rhythm disorder, but because your blood vessels are blocked, the increased heart rate with effort can cause insufficient blood flow through the vessels and make you short of breath. If you have breathlessness due to effort, you may have heart artery blockages even without heart failure or rhythm disorders. You may have had a heart attack in the past without even realizing it. If you have shortness of breath, your first address should be cardiology. The fourth common cause is asthma. Asthma is a prevalent breathing disorder observed in young age groups. A person with asthma may have breathlessness with exertion, but asthma also has this characteristic. If you find yourself in an environment with pollen, cat hair, or dust mites that accumulate in the carpet and can trigger asthma or allergic symptoms, your asthma may be triggered by these allergens. Asthma is an allergic disease and the airways can narrow. Medications are generally used to open up the narrowed airways in asthma. If you are of advanced age and have sudden breathlessness attacks, or if your breath becomes difficult in situations like stress or distress, we generally think of asthma. Asthma is a significant cause of shortness of breath and it has a treatment. I have asthma, don't tell me to tolerate it. If you have asthma, seek treatment. Fifth common cause is anemia. Anemia indicates decrease in hemoglobin value in body. 5.5 val of blood in our body but shortage of blood cells, or lack of iron in blood cells causes this. Iron can't transport oxygen due to deficiency. Even without anemia, individuals may experience breathlessness if they lack iron. Anemia is one of the most common causes of shortness of breath, especially in young women. Anemia should be treated. You cannot say, let me handle it like this. You should address your anemia. Especially young women who have their periods have to deal with a serious anemia issue. My blood level is low, but I don't make any effort. I manage like this. No, you can't. Anemia should be improved. I would like to remind you that the treatment of anemia is usually not very fast and that iron treatment is a long-term treatment. If you have severe anemia, if you have severe iron deficiency, then treatments such as blood supplements or iron supplements sent to the palate may be prominent. But anemia should be treated. 6. The next reason is COPD, which stands for chronic obstructive pulmonary disease. Typically a combination of two diseases. Normally the underlying disease is emphysema or chronic bronchitis. This combination of these two diseases is now referred to as chronic obstructive pulmonary disease. If you have a history of smoking in the past and you are over 40-50 years old with no cardiovascular issues, then it is likely due to COPD. COPD is a disease sensitive to smoking. Emphysema and chronic bronchitis may cause shortness of breath. If you don't have any heart problems, if you are getting older, and if you have a history of smoking, or if you have been exposed to passive smoking, then you should consider COPD and get examined by a chest diseases specialist. 7. The reason is pneumonia. Actually, this is very common but usually a recoverable condition. The person often gets fired. Conversely, there may also be an infection and require antibiotics. If you have pneumonia and the cause is viral, which means it is a condition related to a virus, antibiotics will not work. However, in the case of a bacterial condition, you may need to use antibiotics. Pneumonia is a disease that requires proper treatment to ensure recovery. You usually hear it. When I was little, I had a feverish illness. That's why there is damage in my lungs. Yes, pneumonia, also called pneumonia, is a disease that can damage the lungs, but it can respond well to antibiotics. Take pneumonia seriously. I have a fever. I am short of breath. You must go to the doctor. No saying I can handle it at home. A film about the lungs may need to be made. Your lungs may need to rest. Or you may need to have a tomography. Pneumonia is a disease that needs to be treated and should be supported by an expert. If you have pneumonia symptoms, you must definitely have a chest examination. 8. Our next reason is a bit strange, but anxiety. Anxiety is a common cause of shortness of breath. Anxious individuals, tense and panicked individuals often fail to breathe properly in the stress area, which can cause a feeling of breath hunger. If you feel like you cannot take deep breaths when you are tense and nervous, the primary cause here may be your anxiety or panic attack rather than a severe illness. Panic attacks, anxiety cause shortness of breath. Actually, anxiety is normal, heart normal. Due to sympathetic discharge, catecholamine, adrenaline, noradrenaline discharge, breath may become difficult, heart rate may increase, and we may experience shortness of breath. If there is no reason found for shortness of breath even though you have been to doctors, then the reason may be anxiety or panic disorder, and you may need to consult a psychiatrist. 9. The next reason is lung cancer. I have to talk about this. Lung cancer typically doesn't cause breathlessness until the final stage. If you experience breathlessness, have a smoking history, a family history of lung cancer, and are over 40-50 years old, you should consider the possibility of lung cancer. Let's state that the most common cause of lung cancer is smoking. If you are engaged in a profession that can leave residue in the lungs, such as cigarette manufacturing, or if you are engaged in a profession that involves dust or paint, then you should consider lung cancer. Because these situations can increase the risk of ovarian cancer. If you have persistent shortness of breath for 6 weeks, you should seek support from an expert for lung cancer. Finally, 10. The next reasons are rarer. For example, tuberculosis, the disease known as TB. For instance, interstitial cystitis, or as known the ending of action as pneumothorax. Pneumothorax is a nuisance, especially for tall young male smokers. The collapse of the lungs is when our lungs can collapse on their own or after chest trauma, and we call this pneumothorax. The treatment of pneumothorax is usually done by placing a tube in the lung. The treatment of tuberculosis is based on a 6-month antibiotic treatment. No cure for interstitial lung diseases to a great extent. Also, rare causes of breath mountain, and sometimes it may be necessary to undergo tomography or MRI scans to determine their presence. Sometimes a PET scan may be necessary. We care about shortness of breath. We're not saying my breath is getting tight, but I'm managing. If you are also experiencing shortness of breath, you may have one of these diseases. Or it can be just anxiety or stress without any reason. If you have difficulty breathing, get examined by a cardiologist and a chest diseases specialist. Don't forget to subscribe and enable notifications. Goodbye.